In this video, I'm going to be talking about digoxin, its uses, side effects, and digoxin toxicity. So it belongs to the cardiac glycoside drug class, and pharmacokinetics is really important for this drug as it is a narrow therapeutic index drug. And its half-life is around 30 to 40 hours, so it means it's dosed once daily. It's also renally excreted. The indications for digoxin include atrial fibrillation, which is a condition characterized by a rapid irregular heartbeat, and the emergency loading dose for atrial fibrillation is usually given intravenously over 2 hours, and the maintenance dose for AF is around 125 to 250 micrograms once daily. Note that it's micrograms and not milligrams. It's also used for severe heart failure, and the mode of action in heart failure is that digoxin has a direct effect on the myocytes, so it inhibits the sodium-potassium pump, causing an increase in intracellular sodium concentration, and this causes calcium to move into the cell, leading to an increased contractile force. And in atrial fibrillation, digoxin slows down the atrioventricular conduction, and this leads to a reduction in ventricular rate. And this is done by enhancing the vagal tone. So as digoxin is renally excreted, there needs to be a dose reduction in renal impairment. And also, about the mechanism of action, digoxin is negatively chronotropic, which means it reduces the heart rate, and it's positively inotropic, so this increases the force of contraction, and this is quite useful for heart failure. So this means that digoxin has a dual mechanism of action. So for monitoring digoxin, you need to monitor the heart rate, because as digoxin can slow down the heart rate, it's quite important to measure the heart rate. You also need to measure patient symptoms to make sure that the drug is working. You need to take ECGs and electrolytes, which I'll touch on later. You also need to measure the renal function, because as I've mentioned before, it's renally excreted. And about the electrolytes, they're important to monitor because changes in certain electrolytes can cause an increase in digoxin toxicity. So the side effects usually include arrhythmias, blurred vision, diarrhea, dizziness, and in toxicity these side effects can worsen. So moving on to digoxin toxicity, digoxin is a narrow therapeutic index drug, and this means that small changes in digoxin concentration can cause toxic effects. The therapeutic range is around 0.8 to 2 nanograms per ml. Anything above 2 nanograms per ml can increase the risk of toxicity. So the signs of toxicity include yellow vision, and whenever you think of digoxin, you should think of yellow vision, and it's quite an important counselling point for patients as well to know if they have reached digoxin toxicity. You also have blurred vision, nausea, vomiting, confusion, dizziness, and also bradycardia, which I haven't actually written on the notes. So how can digoxin toxicity be reversed? So you can use something called digoxin-specific antibody, also known as Digibind, and Digibind binds to digoxin and inactivates it. So this is only used in life-threatening overdoses. The digoxin concentration in the body should only be measured 6 hours after the digoxin dose has been taken. This is because digoxin has a long distribution phase. So I'm going to move on to what affects digoxin toxicity, and we'll start with what increases it. So drugs causing hypokalemia can increase digoxin, and these are drugs such as loop diuretics, lithium, and corticosteroids. And the mechanism behind this is because digoxin competes for the sodium-potassium pump. Therefore, in low potassium concentrations, there's reduced competition, so more digoxin binds to the pump, and this increases digoxin concentration. Hypothyroidism also slows down metabolism in the body, therefore there's a reduction in clearance of digoxin. So less clearance means digoxin accumulates in the body. Therefore, dose reduction may be required in hypothyroidism. Other things that affect digoxin are macrolides and gentamicin. The drugs written in green also interact with digoxin, and the digoxin dose needs to be halved when these drugs are given together. So, moving on to things that decrease digoxin toxicity, the drugs include phenytoin, rifampicin, St. John's wort, and sulfasalazine. And to briefly talk about the electrolytes, electrolyte levels can also affect digoxin toxicity, the obvious one being low potassium. There's low magnesium and also increased calcium, and they all increase the risk of digoxin toxicity. On a separate point, digoxin can cause ST segment depression on an ECG, but this is completely normal and it doesn't signify toxicity. So this is the end of the video, and these are basically the notes that I've made, and I'll be adding to the notes. So if you guys would like to have a PDF version, just let me know, and let me know how I can improve my videos next time.